April 5th, 2020. Hi, my name's Tom Yakopin. This is the Tom Yakopin podcast, also known as Yakopinions. So happy Monday. Today we're going to be talking about a very challenging subject, a question that I'm asked often, especially those aging in, 65 to Medicare. And that is, how to navigate the Medicare maze. What is Medicare? Part A, Part B, Part C, Part D, the Medicare supplements, A through J, why all the letters and the confusion. But, for many, in fact, a lot of my friends, are in that time space where they are either thinking about retirement and Medicare. Of course, we did a podcast several weeks ago on the ins and outs of Social Security. Hopefully you got some tips with that. A couple of weeks before that, we did one on retirement annuities featuring Jim Lake's special guest. But today I want to just do a simple, an overview on, Medicare, common questions, concerns, and how to navigate the maze of Medicare. So, here are some typical questions I get at least 5 times a week, right? Tom, I'm turning 65. I'm fixing to retire. What do I have to do and when do I have to do it? Do I need Part B? Here's another one. Very often, if you have worked through, and through payroll taxes, by the way, you're funding Part A, which is the hospital. But typically, you're automatically going to be signed up for Part A, and very often people will get their card as they are nearing age 65. And, they're like, man, I got this in the mail. It says Part A. Do I need Part B? We're going to talk about that. What is Part D? Where did Part C go? A lot of people know about Medicare A, B, and D, but it does seem odd. What is Part C? And we'll discuss that. And of course, the Medicare Advantage, which is what Medicare Part C is. Do I need a supplement? And why more letters, right? So these are some things that I wanted to discuss, and hopefully you get something out of this. And of course, this is my wheelhouse as a professional at West Penn Life. And while I'm not attempting, this probably wouldn't be compliant as a comprehensive training session. It's something to help my listening audience, consumers in the field who are thinking about this, at least get the juices flowing and understand the lion's share of information that I think is key to navigating the Medicare maze. So let's begin with some fundamentals, okay? The first thing that I want to drill down on is original Medicare. And why do I say original Medicare? Well, years ago, a friend of mine said that the number one rule to communication is the definition of terms. So it's very important that you get certain fundamentals right. And original Medicare is really the legal name for what the Medicare system is and what it started out as in 1965, which is when it was introduced under then President Lyndon Baines Johnson. So original Medicare started with both Part A, which was hospital coverage, and then Part B, which is outpatient medical coverage or medical coverage. Could be office visits, testing, therapy, things of that nature, not necessarily related to confinement in a hospital. And years ago, and even today, Part A is typically funded through your payroll taxes. You're not paying anything for Part A unless you didn't qualify as a worker. You can buy into Medicare Part A, and we'll talk about that. But usually Part A is a given, okay? And it should be, because when you think about hospital costs or medical costs, hospital costs can be the most expensive challenges that a consumer faces, right? Certainly much more costly typically than an office visit or an x-ray or a blood test or whatnot. So it was a given that consumers, that Medicare eligibles would qualify and want Medicare Part A. That's your hospital costs. And then optionally, you can buy into Medicare Part B. Part B. And again, that's your outpatient. Now, not everybody, even today, opts into Medicare Part B. And probably 20, 30, 40 years ago, it was, less essential because outpatient costs were considerably less. And I think most often people felt like, I need protection where I'm most likely to face a hardship or a major risk, and that would certainly be hospitals. So everybody typically participates in Part A and has probably since the program began in 65. Part B is optional, but usually when people sit down and talk with me, either in the office or on a Zoom call or over the phone, I highly recommend that people buy into Medicare Part B as well. Well, why? Because when you think about how we obtain care today, the average person doesn't just wake up one day and have symptoms and go, oh my gosh, I need to go stay overnight in the hospital. That's usually not what happens, right? Usually what happens is you develop symptoms, you go see your primary care doctor. He or she will chat with you about those symptoms and then potentially recommend additional outpatient testing, scans, imaging, etc., to drill down on, do you have a problem or not? And again, hopefully, it's nothing, right? But if it does need to or does escalate to a hospital stay, there's a lot of pre and post care usually that is outpatient, which again, Medicare Part B is going to eat the lion's share of that. Okay, without Part B, you'd be on your own, and it could be very costly. So once again, when I sit down and talk with friends, potential clients, and they ask me about Medicare Part A and Part B, I typically recommend get them both. You should have them both. And again, original Medicare, which included Part A and B, was primarily designed to cover older citizens age 65 and above. Although there are exceptions for those considered permanently disabled. For example, if you are permanently disabled after 2 years, you will automatically qualify for Medicare. People with end-stage renal failure or Lou Gehrig's disease will also qualify for Medicare. So there are some exceptions, but it was originally designed for those 65 and above. And again, why 65 and above? Because typically, under age 65, the average Joe, if you take care of yourself, you exercise, and you eat right, the average Joe or Sally Doe is not going to have considerable medical conditions under age 65. And it seemed prudent then, and I think it's prudent today, that 65 is the age where people buy into or age into Medicare, because 65 and above, that's when, as we age, your body is going to begin to break down. I mean, we all die from something. If you're fortunate enough to live to age 90, as my dad did, a very healthy gentleman long into his later years, he was sick very little, much of his life. But the last 17 days of his life were very expensive, and thank goodness that he had Medicare, right? Medicare A and B. And then in his case, he had a supplement as well. But that's what original Medicare is. Original Medicare A and B. And by the way, original Medicare, when I use that term professionally, I always stress how that it is a true national or federal insurance program. So your red, white, and blue Medicare card is funded with the exception of any participation you have for Part B, or if you had to participate financially in Part A. Most don't, but you can. If you didn't work enough, you could buy into Medicare Part A. Up to $471 a month is what it would cost. But even that would be a good deal if you don't have any other alternative. But Original Medicare grants access to any doctor, any hospital, anywhere in the United States from coast to coast that accepts Medicare. So most hospital systems in the United States accept Medicare. So if you stay in Original Medicare and you don't opt into another option such as Medicare Part C or the Medicare Advantage plan, which we'll talk about in a minute, you can go to any doctor, any hospital, anywhere. You don't have to worry about, is he or she in the network? Can I see Dr. So-and-so or this specialist or that hospital out there? And it is very nice that with Original Medicare, you can see any doc, any hospital, anywhere that accepts Medicare. You don't have to worry about networks. And of course, many of you listening in the tri-state area, you realize here in Pittsburgh, for example, not too long ago, we had some turf wars with two large hospital systems. That were saying, if you have this insurance, you can't see these doctors, or this insurance, you can't see those doctors. With Original Medicare, you didn't have to worry about that because there aren't those turf wars with Original Medicare. So as you're navigating the maze, if you were to sit down and talk with me as a professional, that would be one of the first things I ask individuals who are aging into retirement. Are you planning to stay in the Pittsburgh or the tri-state area? Is this where you're going to get your medical care, as far as you know now? There are some exceptions to that. We have snowbirds, right? And that's an individual that lives in Pittsburgh when it's nice, like today. This weekend, we just had a glorious weekend, Easter weekend. The weather just couldn't have been better. There's no place I'd rather be than Pennsylvania. But January, February, March, there's a lot of other places I'd rather be. And some people, right, flee the state and go to Florida, Arizona. So once again, individuals that do some travel, that might live somewhere else half of the year, typically Original Medicare is a huge advantage to them because of the freedom of choice to see any doc, any hospital, anywhere, including routine or normal medical care. But back to my script, what does Medicare Part A cover? What is it? Well, if you are confined to a hospital or you have hospital treatment, and you're confined no more than 60 days, Original Medicare Part A will pay 100% of Medicare eligible charges, subject only to a copay or an out-of-pocket cost to you, the consumer, of $1,484. Okay? And if you think about it, a stay in the hospital today, 15 days is a long stay. 25 days is relatively unusual, unheard of. 60 days, being in the hospital more than 60 days, I don't know what the percentage of claims like that are, but it has to be the exception and not the rule. So if you're hospitalized with Medicare Part A and you don't have any other supplement, no other lotions, potions, or pills, that bill's going to be paid 100%, and you're going to chip in $1,484 if you're confined to the hospital no more than 60 days. That's a pretty good deal. Now, if you're one of the unfortunate few who are confined to a hospital more than 60 days, there are co-payments that you could be and would be responsible for. Which, by the way, is why some people chip in a little when they retire and add a Medicare supplement to their Original Medicare strategy, if that's the strategy that they're taking. But again, I think it's fair to say to a consumer, you don't have to have a supplement with Medicare, Original Medicare. That is completely optional. And I like to tell people that. I like to educate consumers and let them make the decision. But again, Medicare Part A is covering the lion's share of your hospital cost, as well as nursing care, 1 to 20 days with no copay, hospice, and more. So, and again, as I stressed with original Medicare Part A, there's no networks. You can see any doc, any hospital that accepts Medicare. Medicare Part A is typically funded through your payroll taxes, through your working years. However, if you didn't work enough to qualify for that funding, you can buy into Medicare Part A for up to, as I understand it, in 2021, but not to exceed $471 a month. So that's Medicare Part A. Very important. Why? Because if something bad happens, right, you're 65 and older, something bad happens, hospital bills can put a dent in your weekend. I mean, they can be expensive. I've seen it. You've probably heard about it. It's the exception. It's rare, but I've seen $100,000, $200,000, $300,000 hospital bills at times, and it'd be tough to write a check for that. Okay. So then you have Medicare Part B. What is that? Well, that's your outpatient, as we discussed earlier, and that is an option. So that's a decision that you're going to need to make. It doesn't come automatically with the package. You're going to have to choose that. I have had individuals show up in the office and they say, somehow I got Medicare B. It's on the card. I don't remember selecting it, but lo and behold, there it is, Tom. Well, good. I would tell you you should have it. Medicare Part B is important because, again, it is dealing with medical care apart from hospital stay or hospital confinement. And if you think about how medical care is delivered today in 2021, office visits, testing, therapy, on and on. This is where you're probably going to seek care most often. And Medicare Part B, again, with no supplement or nothing, the average individual is going to be asked to pay $148.50 a month to add Medicare Part B. It's a great deal. Do it. Okay. Again, because most individuals are 65 and older. And as I said, from somewhere between 65, 77 for guys, 65 and 81 for women. That's where, most of the bad stuff happens. So you want to have good coverage. There is a deductible with Medicare Part B. What is that deductible? And it changes a little bit every year, but for 2021, it is $203. So the first $203 is on you, okay? That's you pay, then they pay. And then Medicare Part B pays 80% of Medicare-approved charges, so it's 80-20. In other words, if you have a $100 office visit, Medicare-approved office visit, Medicare Part B, after your $203 deductible has been met, they're going to pay 80% or $80 of that office visit. You would pay 20% or $20, just like a little copay. But that's what Medicare B is about. So you have Medicare A, that's basically covering 100% of hospital costs, with the exception of a little more than $1,400. As long as your stay didn't exceed 60 days. And then you have 80-20 coverage after $203 for Medicare Part B. And that's adding nothing at all. And to be very frank with you, that's a nice plan. And most individuals who hit that Medicare eligibility, if they've qualified for Part A, they're paying $148.50 a month for a pretty comprehensive risk management strategy, Original Medicare, which lets them choose any doc, any hospital, anywhere in America that accepts Medicare. No networks, no HMO, EPO, PPO. Molly, is he in the network? Can I go see, Jim's doctor? With Original Medicare, you go where you want, okay? So it's a very nice strategy. Now, having said that, what tends to happen is that when people are aging into Medicare, they're usually retiring, right? So they don't want out-of-pocket surprises, or oops, as I call them, OOPS, oops, right? Out-of-pocket surprise. So they don't want, they're typically settling into more of a fixed budget, fixed income. You don't want a $15,000 surprise medical bill. Like for example, on the outpatient side, 80/20 of a $100 office visit, that's manageable. There's a lot of stuff that can be done outpatient, including same-day surgery, et cetera, that can be very costly. So the bigger the bill, the more your 20% is, which is why very often people who stay in original Medicare do choose to opt for a Medicare supplement with a private insurance company. What does that do? That Medicare supplement, growing up, I always remember Mutual of Omaha's Wild Kingdom. They're famous for selling the Medicare supplements, or United American was big with it. But a lot of carriers today, our carrier, New Era Insurance Group, sells one of the best Medicare supplement plan rates and plans out there. They're all standardized. So all plan A's are the same, all plan G's are the same, et cetera. But basically a Medicare supplement, very simple. It is designed to pay what Medicare doesn't pay. So sometimes people who stay in original Medicare will come to me, get a Medicare Part G or Plan G, and it'll pay everything that Medicare Part A doesn't pay, everything Medicare Part B doesn't pay, with the exception of the annual deductible of a little more than $200. So very nice. So what is Medicare Part C? There's A and B we've covered, right? That's original Medicare. What's Part C? Well, that's known as the Medicare Advantage. And that's a very popular choice today. And it's probably the one that you see most advertising for on television or the billboards or whatever. Why? Because that is underwritten and administered by private insurance companies who have a contract with the federal government. For example, the federal government decided that by offering another choice to consumers, they could, a company such as Blue Cross Blue Shield or many other, Aetna, UPMC, major players, they get a federal contract through CMS, and they can design plans that they have to pay at least what Medicare A and B pay. Can't pay any less, but they can actually do more. So these Medicare Advantage plans tend to add a lot of goodies, I call them, hippie benefits or goodies like what? Vision care, right? Original Medicare doesn't do anything for frames and lenses, but a Medicare Advantage plan might address that. They might add a couple $100 per person per year. You can go and get, a set of eyeglasses or contact lenses or hearing aids. Another is dental benefits. Another popular feature I see is, you get these prescription cards where they put $40 a month or whatnot for over-the-counter medications. And again, usually Medicare Advantage plans include a drug card as well. So it's kind of an all-in-one strategy where a consumer can age into Medicare. They have to have Medicare A and B, but they can actually sign up for a Medicare Advantage plan where you just have the one card. And very often these products look very similar to what people are used to at their workplace. So I think that's why they've become very, very popular. And they're very inexpensive in cases. Like I've seen zero premium. That's right, zero premium Medicare Advantage plans. And then, of course, there's some different options where you can pay considerably more as well. But the downside, if there is a downside to Medicare Advantage, the downside is that it is, as I said, it is administered, run, insured by a private insurance company. And typically, they do have the networks, okay? So you're back to that PPO, that EPO, that HMO design where you're going to have to be mindful of getting your care with doctors or hospitals that participate with your particular Medicare Advantage plan. Now, understand, a very common question that I get from people is, Tom, which is better? Well, they're both great, okay? A lot of it boils down to your personal preference. I know our company, West Penn Life and Health, we have a lot of people on the Medicare Advantage plan, but we also have a lot of people in original Medicare. I think it's important to educate the consumer about the pros and cons of each. I ask my clients to think about what's important to you. Is freedom of choice, any doc, any hospital, is that important to you? Or are you willing, to be confined inside of a network strategy? And then again, co-pays, maximum out of pockets. These are all things that I address with a consumer one-on-one when we discuss this, either by Zoom meeting, over the phone, or in person. And then finally, you have Medicare Part D, which is your prescription drug coverage. Okay. So A, hospital, B, medical, Part C is the Medicare Advantage, and Part D is your prescription drug card. Usually Part D cards, the standalone drug card, are sold in conjunction with a strategy for clients who stay in original Medicare, A and B. They probably buy a Medicare supplement and then get a Part D drug card, okay? For individuals who opt into the Medicare Advantage program, very simple, usually an all-in-one plan. And I think as long as you understand the pros and cons of both, you'll be happy with any of it. Very frankly, it's a very nice strategy, and I get very, very few complaints from consumers that say, I don't like it, So that's a little overview. Again, I do this as a profession, and I wanted to put this out there to educate consumers, but also a shout out to my company, West Penn Life and Health, that if you need help navigating the Medicare maze, I know what I'm doing. A lot of my staff in the office, we are certified with AHIP to discuss and to be able to present these various and sundry Medicare options. I would be happy to help you any way we can. You can visit us online at westpennlife.com. You can also learn more at medicare.gov online. There's a lot of information there about your choices and options, what Medicare is, what it isn't, and how it may help you as you age into the Medicare program. Again, thanks for tuning in. My name's Tom Yakupin, and this is Navigating the Medicare Maze, Tom Yakupin Podcast. Have a super day. Bye for now. Special thanks to West Penn Life and Health, one of our sponsors. You can find them online at westpennlife.com, specializing in affordable life, health, Medicare, and retirement solutions.